Hi there, I'm Laura Lundquist from Zoomers Physiotherapy and Health Solutions. Today I want to give you one of my top tips for pain relief. I have on several occasions been called the Ice Queen by clients of mine because I am well known for my love of using an ice pack for pain relief. I often get the question from clients, should I be using heat? Should I be using cold? I don't really know what to do when. So I'm going to give you some of the guidelines that I use and find to be most helpful for my clients in terms of getting the most out of using either hot or cold in order to get some relief of your symptoms. Generally speaking, when you have a new injury, so I often say, if you have that oh no moment, that's the time to go for your ice pack. So for 2 to 3 days after an oh no moment, so maybe a fall, a stumble, a bump, a quick movement that caused sharp pain right away, those are all good reasons to go to an ice pack right away for 2 to 3 days. And I usually suggest putting the ice on, let's say it was my knee, for 10 to 15 minutes at a time. And maybe to do that at least 2 or 3 times through the day. You could do it as often as once an hour, but often if you do it 2 to 3 times a day, that'll be enough to help get you some relief of your symptoms. When choosing what kind of ice pack to use, I find using something like this that's very moldable and bendable is really helpful because most areas of our body are not flat, like a sort of standard ice pack that you might use in your lunch bag, for instance. So having an ice pack that can mold around the area is really helpful to make sure that you get good contact over that full area that's uncomfortable. And if the ice pack that you're using isn't covered in a material like this, then it's important to make sure that you use a tea towel or a thin layer of a t-shirt or your pants or shirt between you and the ice, because you certainly don't want to give the surface of the skin any frostbite or cold damage from using ice directly on the skin. So like I say, using ice 10 to 15 minutes at a time, 2 to 3 times a day for 2 to 3 days after those oh no moments tends to be one of the best things to do for pain relief. Now, the question of heat, when to use it. Generally, I say after 3 days, you can play around with heat or cold and see what gives you better symptom relief. And if it feels good during the application and then also after, chances are that's a good solution for you. You want to be careful when using heat also to just keep it on for 15, maybe 20 minutes at most so that you avoid getting into any burn scenario. And of course, with a hot application or a cold application, you don't ever want to fall asleep with something like that on your skin, again, just because of the risk of either a burn when using heat or frostbite when using cold. I hope that helps you get some comfort. I hope you don't have many oh no moments, but if you do, remember to pick up your ice pack for a couple of days.